Now, Nigeria's health minister and the Nigeria Center for Disease Control have countless times warned that a second wave of the coronavirus may be imminent. As such, the minister, NCDC, and Presidential Task Force on COVID-19 have been urging Nigerians to take responsibility for their safety by abiding to COVID-19 safety protocols guaranteed to reduce the risk of transmission. Since the pandemic began, Nigeria has recorded 63,328 COVID-19 cases have been confirmed, and if a second wave hits, this figure is likely to go even higher. Joining me in the studio to address these issues is public health specialist and CEO Medway Health Limited, Dr. Tui Meibaodu. Good morning. Thank you for joining us.
Thank you.
Is a second wave imminent with the way things have been handled and with the way things have been going since we had the infection in Nigeria in February? Is a second wave imminent?
Let's look at it. Thank you. Let's look at the figures first and foremost. 63,000. In June, we had, for the whole of June, we had just 580 cases, new cases of COVID-19. As at August, we have just 350 new cases. But in the past few weeks, we've had consistently a minimum of 140 cases every day, totaling 1,400 cases in the past 2 weeks, every day. Now, and you look at the dynamics, schools are opened, bars are working, airport is open. We've opened up a lot of things.
The economy.
We have decommissioned even a lot of isolation centers. You know, probably in Lagos now we have just one that is working. And then you can now remember events of the last 3 weeks, the EndSARS, the protests, and the looting, and all those things that happened. And we saw those instances as an example of super spreaders, you know, that can then, you know, quickly pick the jam and throw it around. And we've seen people everywhere. They had intentionally refused to imbibe those simple,
Intentionally?
cheap,
You call it intentional?
yeah, because again, there are a lot of stories. People don't believe. If you listen to Nigerians, they'll tell you that, no, COVID-19 is a scam, it's not in existence, it's white people's diseases, blah, blah, blah.
Why do you think they have such mindset? Because some persons will say that perhaps the government's risk communication has not really been clear-cut to addressing these issues and make Nigerians believe that this virus, the pandemic, exists.
People can choose to believe whatever they believe, but we know that it exists. We know that it's spread by that format. How it comes to be, it is a subject of a lot of controversies, but we know that there's a virus that exists that can kill. And you can even see that we're seeing a lot of lockdown all around the world. The whole of Europe is locked down. Europe is now the new epicenter of the virus. America has never actually recovered, even entering the election. But for us, we understood from the beginning that there was a huge issue in terms of communicating the right information to the people. Social media has not actually helped in trying to direct people right. Now, what are we talking about? The simple thing of, okay, guys, for us, you know, since we don't have so much money to put into the virus and then bed spaces in the hospital, number of doctors, requisite number of doctors, wear your face mask, keep social distancing, stay at home if you don't need to go out. This simple thing has become so difficult to enforce. And if government is going to do anything now, we need to spend time and money to push those simple things. Now, if you look at it, the countries that have escaped from these things, you see the differences. Compare Korea and USA. Compare China, you know, and Brazil. You will find out that these people instituted a strict lockdown. But I tell you what, it's not going to be the lockdown that we had in the past now, because we have to actually devise what I call a smart lockdown now. It's not going to be the usual one where you have to lock people inside. What's a smart lockdown? It's going to be in such a way that, one, we need to, first of all, deepen testing. I was elated, and I was, you know, happy when we were told that we now have a quick, a rapid test.
Yes.
But where has it been deployed? 650,000 tests so far in Nigeria. 650,000 tests.
And when you look at the population.
Yes, and we have 63,000. In fact, the critical point where you can say that, listen, the virus is going down is when you have less than 5% positive.
Perhaps this is why some persons have said perhaps the second wave might have been before this time that we are seemingly talking about it. Because when you look at our capacity to test, even trace, the inconsistencies in tracing, contact tracing, these are the issues that a lot of persons have said perhaps the second wave might have been even before now that we're talking about.
We cannot be guessing. You see, they must support the assertion with facts. Facts are sacred. It's science. You have to be able to bring out those kind of things, not just assuming. Assumption that's not tested is zero knowledge. So, but even if the second wave has come, like, let's even, for the sake of this discussion, agree that we've seen the second wave, then we're going to see more waves because, one, your borders are open now. People are coming from all those countries, you know, entering your country. Your capacity to test is limited. People are not even adhering to strict, those basic rules that's going to prevent the transmission of the virus. You are creating events of what are called super spreaders, you know, parties, churches, and all those things. You are creating those events. And then thirdly, even your ability to respond to isolation management, it's not just there. You are decommissioning so many isolation centers. Of course, in Lagos, now probably you just have one in Yaba. So apart from that, so if those things are neglected, if we don't really put effort into preventing this thing, the one that we can prevent, we are going to see third, fourth, and then why Nigeria is still lucky is because I keep saying more than 70% of the Nigerian population, if more than 80% are still under 40 years old. Right. So, and then that gives, you know, a window for us to be able to see, you know, a milder form of the virus, a milder form, you know, manifesting. So that is one thing. Then the second thing is that I've been asking the question, we're not seeing even the requisite data that we used to see before, even in other countries. Is the virus attenuating? Is the virus attenuating? Are we seeing a dynamics or the change of that in the virus ability to, the virulence, ability to cause disease and kill people? So it's a lot of dynamics, but what we have, where we are now is such that we're just hoping, praying, and then just wishing.
But then we
that
cannot
is not science.
Yes.
That is not science.
That is it. Because another issue, like you rightly pointed out, is the fact that those who are coming in are not doing the test. That's what the government is saying, that those who are coming in are perhaps either carrying fake results, but some will say that the process for the test, the process put in place by government for those coming into the country has been cumbersome, which is also another challenge. You look at the laboratories, some are saying that they cannot find those laboratories to do the test. I mean, the measures put in place by government, how would you evaluate it to addressing these issues?
Again, you see, if we really need to measure what government has done, within their, you know, thought process, they've tried to do their own best in a way. And then I think we celebrated too soon. We got so complacent too soon about the virus and started throwing cautions at the wind, throwing cautions to the wind, and then opening up. So now, before you can say, okay, wait a minute, I'm going to do that level of opening up. For instance, I'm going to open NYC, I'm going to open universities, schools are going to open. You must have deepened your ability to test. You can't be testing for all the years since February up to now, 650,000 people, and you want to say you have victory. So now, how do we test more? That's the question.
That's the question.
Rapid tests, do we have rapid tests that we can even use to do massive screening of the people? Because when the thing hits us, and then let's say the second
Can the one the Nigerians came up with take care of that?
Well, the other time we had that there was a rapid test.
Yes.
And we're very glad. But now we're not hearing about the rapid test again. So, and this a lot of things, if you don't communicate truth in a pandemic like this, you cause more harm. You must be able to be frank and sincere in what you communicate to people.
So that is one major problem. We have to,
you know, it's a very painful thing to communicate through in this kind of thing. But you must communicate. If people cannot trust you, if they cannot trust you, they will fabricate and build into what you have told them and discredit, you know, your narrations, and that will be a lot of big problem, huge problem, to curtail any epidemic or pandemic.
So talking about building trust at this point that we find ourselves, because if we need to curtail the spread, it means and there is still a trust deficit. It means everyone is, can be a victim of contracting the virus as it is, because it is spreading. Perhaps, how do we begin to maybe use local communicators, talking about the religious leaders and all of that, to perhaps begin to talk about this message? Maybe the people would believe. That is another aspect that people are saying Nigeria could explore.
No, the thing is that without sounding like a broken record, at the beginning of the onset of this pandemic, we've done a lot of communications in terms of how do you deepen communication. Because we miss a big gap when we refuse to bring influencers. I'm not talking about social media, I'm talking about Twitterati or please. I'm talking about influencers like the church leaders, the community leaders, to let them understand this thing properly and be our focus of communication. Because these people have a lot of influence, and most of the doubts that were thrown at some of the theories surrounding COVID came from those areas. So what it means is that we missed a critical gap in letting them understand what exactly we're all about and the COVID prevention is all about. If then we had recruited the ballers and the chiefs and the market women and the different
leaders,
associations and the National Union of Road Transport Workers and all those people at their sectors, and we're deepening communication at that level, perhaps we may not get to this level of distrust. But having chosen to say that, government now amounts and say that, listen, we know everything, we can do everything, we don't need anybody, then we allow that gap to happen. The religious organizations started putting holes into every argument concerning COVID. They just look at it and they say, okay, it can't be this, it can't be that. And then, lo and behold, they had, amassed a lot of followership. And then it became so difficult for government, to be believed. Now, what we need to go back to, honestly, is to deepen those communication, is to reassess the depth of our communication and how we communicate to those critical group of people. And we're talking about market women. And then we have to look at what I would call the clusters. There are clusters that can serve as super spreaders, okay? Yes. We need to do more work at the level of those things. At a center where I was some weeks ago, that's at Freedom Park, for instance, there are clear-cut arrangement on how to really follow up the attendees of events there and see how they're doing. I think a place like that or social gathering center should be able to put something in place that can help a bit of follow-up. Tiny forms, you feel, and then people
to help contact tracing.
Yeah, to help contact tracing. Have you been in an event before, in the last so hours? Have you fallen sick? Have you run fever? Have you been to an hospital? Those things, if you have anything, call us, we can help you. It helps to reassure. So we must devolve the communication methodology. We must devolve it and make sure it gets down to the bottom as much as possible. Government cannot then warehouse all the communication, warehouse all the information, and then giving briefing. Is it daily now or still weekly? Has been giving. Don't have many people have like to even look at that.
Yeah.
There are critical ways you can communicate these things to people, and you're not exploring it. Okay? So the government cannot be the all-knowing. They can't be. It's too much for them to do. The earlier they realize that, the better. So we need to work on, if you're going to spend money, spend more money on those communication, communicating social distancing, communicating face mask, communicating hand sanitizer, basics.
Not even hand washing this time.
Hand washing sanitizer, very basic.
All right.
Basic.
Now, another aspect is the fact that some persons are saying perhaps we should look at involving persons who are survivors in this communication that we are talking about, that maybe people will believe, because the question you see people are asking, we haven't seen anyone, because on social media yesterday I was reading a comment someone made and it was like, there's nobody, he hasn't seen anyone who died as a result of the pandemic or who contracted the virus. He hasn't seen anyone. He was asking someone, is he your family? Did you see the person? Perhaps when we begin to bring in survivors, maybe that could help. Could it? Do you think so?
It did, because, survivor, at a point in time, they were considering using the plasma of survivor as a mode of treatment before it was discarded, okay? Yeah. I don't know why government is not recruiting, but even at the beginning, we saw a lot of people who were coming out and telling their stories.
At some point.
Yes. about how they survive COVID-19 and reminding all of us that COVID-19
But a majority
is
of
real.
these people are on
Now-
social media, and you find them on television stations, which not everyone has access to.
So the government should understand the cluster, like I was saying, the clusters. You look at the clusters. Where is this argument? Where the disbelief or the doubt? Where is it predominating? Where, how do we now address it? Of course, you remember, even some of the countries we look up to as the epicenter of science, you see the political issue because
yes, around
around COVID-19, and it became such a huge problem that people will be citing that if this country is not believing it, if this leader is not believing it, why should I believe it? Okay, so it's a muddy thing, but we must act locally. We must act at an individual level to say that, wait a minute, I don't want to die now. Because, number one, tell you what, if anybody falls sick and think that he has a good hospital anywhere in the country, he has the requisite number of medical doctors anywhere in this country that is going to solve his problem, the person is joking.
Really?
It's joking. Yeah. How many beds do you have, for instance, for COVID-19 before the decommission? Less than 1,000 beds. Okay, for intensive, where we even get 1,000 beds. Now the whole thing has been decommissioned. We're just having Yaba. How many beds do you have in Yaba, for instance, to serve 220 million people? If we say that the rate of infection is 2%, you know that we are talking about 400,000 people that can get infection, and then if 1% of them get so sick, then we're talking about close to 20,000 people. Where are you going to put those people? It's not just possible. So it is important, apart from the fact that we're having a lot of diseases that's a burden on us here, it is also important that we don't add COVID-19 to our problem. So individuals must act at that level and ensure that you observe those things that can prevent you from contracting the disease.
Quickly before we let you go, some persons seem to have forgotten what the symptoms are. So maybe you just touch on that before we let you go once again as a reminder so that people can be conscious, perhaps, that when they see the symptoms, they know that, okay, this is what it is.
Now, we know that with COVID, fever is one of the symptoms. Okay, of course, the fever is so common in Nigeria. Catarrh and cough is one of the symptoms. Sore throat is a common thing. And when the cough and the sore throat is coming, it's important that the person needs to do a COVID-19 test. Any respiratory tract, upper respiratory tract infection is an indication for one to check for COVID. And of course, it interacts with so many other diseases, and it can affect the whole system of the body from the head to toe. Brain, kidney, liver, heart, COVID-19 and blood system can affect it.
All right. Public health specialist and CEO Medway Health Limited, Dr. Tuime Bawandu, thank you so much for your time on the program.
Thank you very much.